So there's this Wednesday afternoon I was relaxing in the consultation room, and a female walks in and she tells me that she has been on anti-TB medications for a period of 2 weeks. Now I got curious and I asked why and what brought her to the hospital. She told me that she has been feeling chest pain just behind the sternum that was not getting any better. So because she told me that she was already on anti-TB, so I decided to rule out for any symptoms of TB. So I asked her whether she had night sweat, she had lost weight, or how severe was the chest pain. Surprisingly, she never had any of those. So this got me curious and I began to do my own investigations, and it led me to this. H. pylori. H. pylori is a bacteria which is gram negative, and it is flagellated and it is helical in shape. So given those three terms, flagella, when you say flagellated, it means that it has got some finger-like or rather leg-like structures that helps it move around easily. The helical shape is actually the shape that it forms or the shape that it has. So I don't know how to explain helical. Helical is helical. The way circular is circular, trapezium is trapezium. So helical is helical. And it is also gram-negative bacteria. So this bacteria is the bacteria that gets inside the stomach and starts to cause symptoms of gastritis. So how do you get this H. pylori? H. pylori could be gotten in a number of ways. And just to take you back a bit, you know, in the years 1800s up to the year 1875, 1880s, scientists were in a consensus that there is no way a bacteria could grow in a medium that was totally acidic, just like inside the stomach where we have the gastric acid or hydrochloric acid, which is very acidic, actually more acidic than even the acid that is found in the car batteries. So at this point, the scientists were in a consensus that there is no way any bacteria can go in any shape or form in such kind of an environment. Until the years 1982, when there were these two scientists from Australia. They were Robin, Warren, and Barry Marshall. So they are the scientists who came from Western Australia, and they did this research, and they were actually able to isolate H. pylori and describe its shape and how it stains based on the explanations that I gave you when I was beginning this presentation. When I said that H. pylori is gram-negative and it is helical in shape and it is flagellated. So they are the people who came up with this definition after isolating this bacteria from the gastric mucosa. So they are the people who made us understand how this particular kind of bacteria affects the human body. So with that kind of background knowledge and now knowing that it could thrive in acidic environment, it brings us to the question, how can one actually contract H. pylori bacteria? There are a lot of misconceptions that are being floated out, but the fact remains that H. pylori is actually contagious. What I mean by this is, if one person has it, he or she can pass it to the next susceptible or rather exposed host. So you can get H. pylori through oral route. Basically what I'm saying, through kissing, exchange of saliva. So if you go kissing around people whose history you don't know, you could acquire H. pylori through this. H. pylori could also be gotten through orophycal route. So there is no sweet way to package this. Orophycal means just kisses through the mouth, okay? That is what it typically means. So regardless of how it gets inside your system, that is up to you. It could be through ingesting or taking contaminated water, contaminated foods, or rather eating without washing your hands, having greeted somebody who didn't wash their hands quite well. So through that, you get uh, to acquire H. pylori. So those are the two main ways in which you can acquire this. But now there's some good news. You know, H. pylori affects almost two-thirds of the world's population, to mean that almost everybody has H. pylori, but a majority of people has what we call the non-pathogenic strain, or rather, it means that you could be having H. pylori, but it is not causing any symptoms in you. So majority of people have H. pylori, but they are asymptomatic, or rather, they lack symptoms, such that H. pylori is in their system, but it does not cause any symptom. It is in a dormant state. So that is why majority of the people do not actually show the symptoms. But to the few, or to that percentage of people who show the symptoms could vary from one person to another. And the symptoms could actually be a reflection of the stage of the infection, or rather colonization, that the bacteria has gone through inside your stomach. So it is important that we understand what really makes H. pylori affect our stomach and duodenum and cause these ulcers. What makes it special apart from other bacteria, because it is not the only bacteria that lives or thrives in our gastrointestinal tract. There are a wide number of bacteria. But what makes it special so that it can be able to colonize us? So the main things that this bacteria has are the flagella that actually enables it to move around to find a place that it is going to attach to. The second secret is in its shape. When you look at its shape, it makes it easy for the bacteria to form burrows, or rather to dig some sort of holes in the gastric mucosa, or rather the lining of inside the stomach, where it now sits in and begins wreaking havoc. Then thirdly, the secret lies in the enzyme that it has. H. pylori produces an enzyme called urease. Now this urease enzyme is able to break down urea into carbon dioxide and ammonia. So this carbon dioxide and ammonia is able to react with these strong acids which are found within the stomach, and this neutralizes the environment around them, thus enabling them to survive for a long period of time inside the stomach and eventually establishing an infection. Another thing, it has got another enzyme called arginase. So arginase is another form of an enzyme, which is a metalloenzyme that has the capability of reacting with the strong acid that we find within the gastrointestinal tract. So the combination of these factors really provide an enabling environment for this particular bacteria to establish an infection inside the human body. So what should we expect when you have H. pylori? There is a wide variety of symptoms that could vary. Others could arise from whatever it is that I've explained. So once the H. pylori virus gets into your system and begins the disease process, the first thing that will appear is what we call gastritis. Gastritis basically is the swelling of the walls lining the stomach, and in some cases it could even extend to duodenum. So it begins as gastritis, or rather the swelling of the gastric mucosa, or the cells lining the inside of the stomach. If this is not treated, this gastritis could progress into chronic gastritis. So it means that this swelling has not been treated for a long period of time, and then it has now become a chronic thing. A chronic thing means that it is something that has gone for a longer period of time, and it has not been managed promptly. Now, if this chronic gastritis is not actually managed adequately on time, it could now complicate to what we call ulcers. Now, these gastric ulcers are now the hallmark of this infection, and what potentially leads to complication of H. pylori. So the symptoms could arise from any of these stages, and the symptoms could include stomach ache that could be burning in sensation. And in some cases, it could be severe. And in most of the cases, it's normally in what we call the epigastric region, the upper part of the abdomen. So there could be that pain. There could be bloating or rather feeling of fullness that is unexplained. Remember, I told you that H. pylori has got an enzyme called urease that helps to break down urea into carbon dioxide and ammonia. So these gases brings about the feeling of bloating, or rather you feel that your stomach is full anyhow, anytime. You eat something small, you are almost full, you are bloating, you are belching, releasing gas, flatulence. Another thing it could cause is loss of appetite. The other symptom that could occur is nausea. You feel like you want to vomit, and in some cases you could vomit. So these symptoms could vary, just as I have said before. The only important thing is that if you get any of these symptoms, or even others, which I would list here, it is important that you go get checked up. So I said, if it is not treated, it could progress into ulcers. So when you have gastric ulcers, the risk is that they may begin bleeding. So bleeding ulcers could present with symptoms like somebody who is vomiting blood, or when you pass stool, the stool is dark in color. So the stool is dark in color because there's bleeding inside the stomach, and because of this particular bleeding, the blood is being digested and passed out in stool as dark. So that is what causes the stool to be dark, the blood that has been digested as a result of bleeding of the ulcers. So at this stage, we say that it is at a very high risk of complication and even developing what we call gastric cancer or cancer of the stomach. Remember, this H. pylori has been attributed to almost 89% of cases of patients who have stomach cancer. So it is important that when you have any of these symptoms, you get checked early in advance so that you prevent potential complication into ulcers and even possibility into ulcers. Again, if this condition is not managed well on time, you could also develop what we call gastroesophageal reflux disease. Now, it means that the acid in your stomach could be climbing up the esophagus, and when it climbs back in the esophagus, going up into the mouth, it could cause irritation along the esophagus. So this irritation can lead to what we call esophagitis, or rather swelling of the esophagus. So swelling of the esophagus can present as pain, and because esophagus is found just behind the sternum, this bone in between the chest, in the middle of the chest, you could present with chest pain, just as that patient presented with. So that is that. It is important that you understand all that. Now, the good news is H. pylori could be treated, and I am not a fan of telling people used home-based remedy or you drink what, drink ginger, drink what. If you have symptoms of H. pylori and you have been tested, it has been positive, it is important that you get treated by a medical practitioner. There is no two ways around it. So how do we get to confirm that really you have H. pylori? So the first thing is that we'll do a test on you. The test that I normally prefer is what we call H. pylori antigen test, a test that we do on the stool. Now you come, you give us your stool, and there's a way we run it in a rapid test kit. Now this one is going to target specifically the presence of the H. pylori bacteria. However, there is another way that we normally do the H. pylori antibody test that is normally done on blood. But I don't prefer this quite well because you know it is an antibody. So if you have H. pylori and you've never shown the symptoms, when we do it, we could find the antibody circulating in your system and you could be treated for something that really you don't have. Or if you had H. pylori previously and been treated Now, if we do a blood test, there's a possibility that we may find the antibodies circulating within your system. So I don't normally prefer that quite well. So the test that I prefer that be done on you is H. pylori antigen test. So it is important that you also note that H. pylori could be found within families. Remember the route that I said that you can acquire this particular kind of bacteria. For example, you are in a family, maybe your dad, your mom is sick, or your siblings are sick of the H. pylori. There's a very good chance that you could get it. Remember, it was through orophycal or rather change of mouth fluids, especially saliva. So that is why in most cases you find one person in a family has it, there is a possibility of transmitting it to other members of the family because you share a wide variety of personal effects. So it is just as important that you get tested and a treatment to be done by a qualified medical practitioner and to be done in completion, because if it is not done, it has the potential of complicating into bleeding ulcers and even predisposing you to things like cancer of the stomach. So ladies and gentlemen, if you have any of those symptoms, consider being tested for H. pylori so that you get treatment on time. Until next time, this is Koegido.